An infant on his 14th day of life enters the emergency room. He are tachycardic, has poor skin turgor, and is crying without the formation of tears. The nurse knows that this child is showing symptoms of dehydration. The doctor orders fluid replacement of 544 milliliters over 5 hours. What is the drip rate of the infusion? A. 110 milliliters per hours. B. 108.8 milliliters per hours. C. 175 milliliters per hours. D. 200 milliliters per hours. E. 54.4 milliliters per hours. The answer is B. 108.8 milliliters per hours. The question says, over 5 hours to give 544 milliliters. So, in 1 hour give, 544 divided by 5, ml equals 108.8 milliliters. An 11-month-old child weighing 8.6 kilograms enters the emergency room with symptoms of a severe respiratory infection. Her physician suspects bacterial origin and prescribes ampicillin. The guidelines state that ampicillin is to be administered as 50 mg per kg per day in a dose 6 hourly. Ampicillin comes in 250 mg IV solutions of 50 milliliters. How many milliliters should the nurse administer for each dose? A. 25.5 milliliters. B. 250 milliliters. C. 107.5 milliliters. D. 50 milliliters. E. 21.5 milliliters. The answer is E. 21.5 milliliters. Weight of the baby equals 8.6 kg. Prescribed dose of ampicillin equals 50 mg per kg per day. Daily dose of ampicillin required for the baby equals 50 times 8.6 mg equals 430 mg. Dose of ampicillin to be given every 6th hourly equals 430 divided by 4 equals 107.5 mg. According to the question, available strength of ampicillin equals 250 mg in 50 milliliters. That is, 250 mg is there in 50 milliliters. 1 milligram is there in 50 over 250 milliliters. So, 107.5 milligrams is there in 50 over 250, multiplied by 107.5 milliliters equals 21.5 milliliters. Evelyn is a 3-year-old girl who has been bitten by her family's dog. She has had an incision and drainage, I&D, of her left hand to prevent infection, and she has been prescribed cefazolin. The guidelines for cefazolin are 25 mg per kg per day. Evelyn weighs 42 pounds. How many milligrams of cefazolin should the nurse administer daily? A. 524 milligrams. B. 367 milligrams. C. 819 milligrams. D. 475 milligrams. E. 1025 milligrams. The answer is D. 475 milligrams. 1 kilogram equals 2.2 pounds. Weight of Evelyn equals 42 pounds equals 42 divided by 2.2 kg equals 19 kg. Prescribed dose of cefazolin equals 25 mg per kg per day. Required dose for Evelyn equals 19.1 times 25 equals 475 mg per day. The nurse must administer 1 liter of sodium chloride solution over 8 hours. What is the appropriate rate in milliliters per hour that the nurse must set on the IV pump? A. 125 milliliters per hours. B. 150 milliliters per hours. C. 100 milliliters per hours. D. 200 milliliters per hours. The answer is A. 125 milliliters per hour. Required dose equals 1 liter in 8 hours equals 1000 milliliters in 8 hours. So, per hour dose equals 1000 divided by 8 equals 125 milliliters. The nurse prepares to administer naproxen to his patient. The physician has ordered 1,500 milligrams per day in divided doses. The medication label reads 1 tab equals 0.3 grams. How many tablets equal the daily dose of this prescription? A. 5.5 tab. B. 4 tab. C. 5 tab. D. 3.5 tab. E. 4.5 tab. The answer is C. 5 tab. Strength of 1 tab equals 0.3 grams equals 300 milligrams. Prescribed daily dose equals 1,500 milligrams. Tablets required equals 1,500 over 300 equals 5.